I can't believe I have to give a report to Janie. She's been here for like 18 years. This is gonna suck so bad.
It's almost 10 after. What's your nurse's name today? Who is it?
I have no idea.
Oh, I hope she hurry up. I gotta get going. I've got a lot to do. Where she's at.
Janie? Oh, hi.
Hi.
Sorry, I had to hang the last antibiotic and then I had to finish the charting. And, you know, at 6 o'clock, like everything happens so quickly, like right at change of shift, and then of course everybody has to go to the bathroom, and then you're like trying to help them, but then nobody has their phone anymore because we all give it to them.
Focus now. Let's start now. Let's start now, okay?
All right. So this is our patient, and she's fine, and she came in because she was having pain. And so she has a lot of pain all the time.
Hey!
And she's a 10 out of 10. So all night long,
Yeah, I'm in the
that's all I've
hospital.
been giving her. I gave her
Okay.
Ativan and
Okay.
Zofran together, and that didn't really help her pain at all. So I called the doctor and gave her 2 milligrams of Dilaudid with some Benadryl, and she fell asleep for like an hour, but not very much.
What is she even here for? I wonder if she's ever going to give me something I can actually use to take care of this patient.
So she came in because her stomach hurts and her leg hurts. And then, like, when she was eating sushi yesterday, like, her stomach really hurt, and she thought she was going to throw up, and it was really bad. But
Sushi?
she didn't throw up. It was okay.
I hope
She-
you don't get mercury poisoning from that sushi.
I eat it all
It's
the time.
good. You haven't been to Devorn's? Oh, my God, they have the best
I'll
sushi.
have to try it.
Oh,
I'll
my
be down
God.
there.
I took my husband there the other day, and we were, like, so amazed by how delicious all the food
I
was.
got it.
Okay,
Hold
just
the report.
hold it.
Give me a report.
It's okay. You know what?
Give me a minute.
I think she has a brief on.
Hold it.
So it's okay. You could just go in the brief. I know you could walk and stuff, but just go right now. It's faster, easier. Okay, it's
Everybody's
good.
busy.
Gosh, they want me to pee in my brief? Hello, I'm only 30. That is disgusting.
When the aides come in, then they'll help you and stuff. Okay. Okay. So
What's
So-
going on with her?
her name is Sarah, and like I said, that's why she's here. So she has the yellow band on because she's a fall risk, and then the red band because she has lots of allergies, like a lot. If
Well,
you print out that sheet, it's a lot.
actually, I'm mostly just allergic to everything except for what's that one that starts with a D? Delantin, Dilaudid.
Dilaudid.
Yeah, I'm allergic
Yeah.
to everything except for
Of course
Dilaudid.
you are.
That's the good stuff.
I gave her Dilaudid every 2 hours, 1 milligram, except for the one when I called the doctor and I got a one-time order for 2 milligrams, and that was about 30 minutes ago. I gave it to her, and she's fine. She has her mask on. Sometimes it comes off the wall, but I think it's okay. She doesn't. Okay, so she has an IV, but they put it in on the previous shift, so I don't know where it is.
Don't play the banana. Don't play the
I
banana.
think it's on the right side in her AC. Okay. And she likes the pillow like under her back right here, and then like the blanket over her face because her head hurts. But she's not really eating very much. I tried to get her to eat, but she just had some yogurt.
Is she always like this?
Yeah, when her pain gets really bad, she gets really upset, and then she can't handle it anymore. And that's when you have to run and give her pain meds. Because otherwise she starts crying, and it made me feel so sad. It reminded me of my cousin, and my cousin fell over her leg, and she was crying so bad, like big tears.
Is she okay?
She's fine. That was like 4 years ago.
Oh, that's terrible. Things happen in your family like
I
that.
know,
It's hard
right?
to concentrate on work when all that's going on in your family.
I know, right? And then I'm new, right? So this is like only my 2nd day by myself, and
Hey,
I have 5
listen.
patients.
Nobody cares. I have to pee.
I told you to go in the brief.
Honey, it's fine. Just go.
Just go to the bathroom. You're fine.
Almost done.
I don't want to throw you on. Just go.
We're almost
You're
done.
fine.
Okay, so now what's the plan for today? What's going
So
on
we're
today?
doing pain management. She might have some underlying conditions, but she's not really sure. History.
Don't do that. Please, please.
She likes her gloves. So you have to give her her gloves. When she goes to the bathroom, she likes her gloves.
Okay, she can walk to the bathroom?
Yeah, she walks to the bathroom even after I give her the Dilaudid. I keep forgetting to turn on the bed alarm, but every time I come in the room, she's in the bathroom. She's
Are we
fine.
sure calls if you need to get up, ma'am? Has she been like that all day?
Yeah, that's how she is. I know, it is so
This
bad.
night is going to be impossible.
If you just stay on her Dilaudid, every 2 hours just bring it in, it works just
Right,
fine.
yeah.
She's supposed to have an MRI today, but she's really claustrophobic, like super claustrophobic, like so bad. And so you have to give her Ativan and Benadryl and Dilaudid all together, and then when she gets back, then give it to her again so that she can sleep because she gets so anxious.
You know, I used to be claustrophobic, and it was terrible. I finally went to a doctor, and we talked all about it. It had to do with when I was a little girl, and it was just a really long story. Maybe we can talk about that tonight.
Oh, yeah. I don't know anything about my patients, and I'm like, oh,
Honey,
let
we
me
talked
tap
about
in
that.
for
We
you.
talked about that. We talked about
It's
that.
so bad. Okay,
I
so
don't know how you stood it all day.
this floor is so crazy. I don't know if I
Job
can do it.
sometimes. I know, Sam.
Oh
It's
my
okay.
gosh, okay.
This girl is so frazzled. I just don't think she's going to make it on this floor. So now, what else is going on with her vital signs?
Okay, so sometimes her blood pressure goes really high, but sometimes it goes really low. Like the other day, they said that her blood pressure went to like the 90s. But I think that she was getting a lot of medication because she said that she felt a little woozy. That's why she has the Venti mask still, but sometimes she doesn't use it. She only uses it when she feels like she needs
It
it.
sounds like she's a non-compliant patient.
I'm sorry,
Oh.
what does that mean?
That means when you have your diabetes, she doesn't take her insulin because she doesn't have a shot.
I tried.
I know, that's what I'm telling you.
You didn't try hard enough, or you would have taken it.
She did. She really does try. But her mom also has diabetes, and she's really old, and she's fat. So she needs even more insulin. Okay?
How about her risk factors? What's her risk factors?
Oh yeah, so Sarah has lots of risk factors. So like when she was 14, she was cutting.
Honey, shh, we can't hear. We can't hear.
Oh, sorry. I love this.
Just keep going on the wrist. Keep going on the
So when
wrist.
she was 14, she used to cut herself. But then she moved to San Diego and she went to some camp. And she's fine since then.
Who's that?
Oh, that's just Jason. He's fine. Don't worry.
Okay.
I told her that in confidence. I don't know why she would tell the other nurse that. And who the heck was that creeper in the corner with the clipboard? That's so embarrassing.
What was I saying?
Her risk
falling.
factors.
So
Fall.
she is a fall risk because she has the yellow band. Did I tell you that already? I feel like
I
I
remember.
said
It's
that.
so scattered. I can't even know what we've been talking about so far.
We've been talking about Sarah. Anyway, so when she
That's not my name. That's my middle name. Are you sure you even have the right information?
of course I do.
Your name is Sarah Jones, right? And you're going to have an appendectomy. An appendectomy.
No.
Appendectomy.
Joanna Sarah.
Yeah, but I call her Sarah.
Okay. You sure you have the right patient?
Yeah, totally. I know.
When am I getting out of here? You guys are freaking me out.
What's her discharge planning?
So after the MRI tomorrow, the doctor said that if it's fine, then she can go home. But make sure that you give her her payments before she leaves, because she's been getting it around the clock for the last 4 or 5 days. I might need methadone as well.
We're not going to start that here, hon. Come on. Be strong.
No, I think I told you everything.
I don't know what's going on in this room, but I guess I'll do the best that I can. I should have just given myself the report off the computer. I'd have more pertinent information to go by.
You'll be great. She's fine. She's a great patient.
I have my cell phone. I'll be fine.
Yeah.
Sometimes she just texts me, like to tell me that she needs something, and then we've been good. I won't even come in unless she's
We're actually friends on Facebook.
Yeah, I totally added her. Her Insta is so fantastic.
Okay, well, we're not going to be Facebook friends. And if you need me, I'll be back in a couple hours, okay? I'll be back.
I'll see you tonight, okay?
Whatever.
Bye.
She needs a chill pill.
Peace, girl.
Bye.
You think maybe I should have told her that we had to Narcan her and called an RRT? No, it's fine. She's fine now. It's alright. I don't want to get in trouble.
Hi, we're the Bedside Report team. We're being a little silly and funny with this video, but the main purpose of it was to show all of us how to give proper reports at the bedside involving our patients.
And that's the point of bedside report, right? That the patient and the family get to be part of the care, and that really reduces anxiety and makes the patient feel safe. Sorry.
And it's good to all be in agreement on the patient care plan.
Min.
Good morning, Joanna.
Hi, good morning.
This is Jamie. She's going to take great care of you tonight, okay?
Hi, how you doing?
Good.
So just like we talked about earlier, I'm going to give her a report, okay?
Okay.
All right. All right. So Jamie, this is Mrs. Doe. She's a 30-year-old full coat patient, a doctor attending, and doctor specialist is consulting. She's allergic to penicillins. She came into the ED on April 10th for heartburn, chest pain, as well as nausea and vomiting for 3 days. So when she was downstairs on the 10th, she had an EKG, which showed normal sinus, as well as an abdominal ultrasound, showed gallstones. Doctor specialist scheduled her for a lab chole today at 10 o'clock.
10 o'clock. All right.
Previous history includes GERD and diet-controlled diabetes. We are doing blood sugars, ACHS, but no coverage. If they're greater than 180 times 2 in 24 hours, call the doctor. For me, they were 110 and 97. So we're doing vital signs Q4. She's on room air. Her sats are maintaining 98 to 100. Last heart rate we took was a little elevated at 102, but we were talking and she admitted that she's nervous.
Yeah, that's all right. That's normal to be nervous.
So we went over some calming techniques and her heart rate went back to the 70s.
And we'll work on that again today also.
Okay. That sounds good.
All right.
Mrs. Doe is a fall risk. She signed the false agreement. Vet alarm is on.
Okay.
She ambulates just well with standby assist. She denies all SI and has a Braden scale of 17 since she hasn't been eating all the last few days.
Okay.
She gets up and ambulates with us to the restroom, and so she has her scuds on while she's in bed.
Okay.
She does come now.
Be sure and call us if you need to get up to the bathroom.
I know my
Let me know.
husband put the rail down earlier. I don't know if you guys wanted it up or down.
Oh yeah, let's fix that.
We're trying to keep that up for your safety.
Okay.
When did John go home?
Probably about an hour ago. Then go home feed the dogs.
Okay.
Skin.
All right.
Mrs. Doe doesn't have any skin issues. She has a couple moles, but we don't chart that. She's a 20 gauge in her left forearm.
Let me see that one here. Oh, okay.
It's saline locked, but I flushed it about an hour ago and it was fine.
All right, great. We'll be using that for surgery, so that's why
this
we're
one.
checking.
Oh,
Yes.
okay.
She did have a CBC and renal this morning, but they haven't posted yet.
Okay.
Her ADMET labs were unremarkable. Her A1C was 6.0, which is why she's not on. So Mrs. Doe doesn't really call for pain meds until her pain gets like to a 7. So we've done a lot of education on pain control. She doesn't take anything at home. So we did a lot of non-pharmacological pain control.
Okay.
That seemed to work.
Right. It's really important that you stay comfortable. It'll help in your recovery.
I know.
So
I need to call. I need to not wait.
We'll talk about that more also.
Okay.
She does have Norco 5 every 4 hours, which I just gave her at about 4:30. And then she has Dilaudid 1 milligram. I haven't given it to her yet.
Okay.
I completed your pre-procedure checklist. We did the bath. She's NPO. Doctor specialist came up about 2, 3 o'clock,
I
something.
think so.
And they discussed the risk. Mr. Doe was here, signed the consent. So that's in the chart ready to go.
If you think of any other questions, be sure and let us know, and we can address those.
Okay.
We'll plan to go home with her husband,
Great.
hopefully tomorrow or the next day, depending on how surgery goes. Most of our efforts this evening have been on pain control, and then I educated her on the incentive spirometer, importance of early ambulation.
Great. We'll work on that together.
I got some goals.
So she's good. All right, Janie, questions, comments, concerns?
I had a question about her last bowel movement. Do you have that
Okay.
recorded?
This morning.
Oh, this morning. Okay,
Mhm.
great.
And she's been voiding really well. Output is charted and the hat is in the toilet. She knows that we're measuring. Her biggest concern, besides all of that, is going back to work. Well, maybe when Dr. Tending comes in this morning, we can find out what he thinks and maybe get a note for work.
Okay, we'll help you arrange that. We'll get that paperwork filled out for you.
Awesome.
Okay.
All right, Joanna, that looks like it's it. Do you have any other questions or anything to add?
So who's gonna call my husband after surgery?
Actually, he'll go down to surgery with us, and they'll show him where to wait, and the
Oh,
surgery team will keep him apprised of what's going on.
Oh,
So
good.
he'll know where you're at all the time.
Oh, good. Good.
Questions, comments, concerns?
No, I think that you covered it all. Thank you very much. So I'll be back in about 30 minutes to talk to you.
Okay.
Okay.
Sounds good.
All right.
See you tomorrow, Sam.
See you tomorrow.
All right. The communication is key. We're all very aware that lack of communication or poor communication is one of the leading causes of death and injury in hospitals across the country. So during report, it's not a bad thing that we hold each other accountable. It's an important thing and it's a necessary thing. That way we can continue to elevate practice and we can continue to provide safe care always to the patient no matter what. We work in a very high stress environment. So we're not doing ourselves any favors by not taking the time to coach and mentor when you see a moment that the person is struggling. So if you're that nurse that's struggling, just be honest. Say, hey, I could really use some tips. But if you're that person that notices that someone's struggling, don't just 5 minutes after report, oh, Janie's the worst, she XYZ. Take that time to coach and mentor.